scheduling.
For like the most addicted heroin.
Okay, so heroin is like a scheduled 1 drug, okay? Most addicting,
That's not used, like there's no medical reason for it.
no medical reason to use it, beautiful. What else?
Cocaine, same category.
Okay.
Cocaine is in the same category, go ahead, Leslie.
Then we have substance 2, which is high in abuse, and it comes with severe dependence.
Okay,
It includes narcotics, amphetamines, and barbiturates.
is there a medical use?
Yes.
Yes, there is a medical use. What drugs?
Yeah.
Phenobarb, Percocets,
Morphine.
fentanyl. Okay, and Schedule 3s, what do you got for that?
Moderate abuse,
A potential,
potential. It's like hydrocodone.
okay.
Potential.
What about 4? Way down at the bottom of the list.
Flowers, like Xanax.
I don't even think Xanax, I think it's even,
Xanax 5.
I don't think it might even be lower.
What is this?
No, not lower, I mean, there's more abuse potential with Xanax. It's a benzo, but you can still have abuse potential with it. So we know as we go down the scale, or up the scale, however you wanna think of the Roman numbers, 1 really has no medical use at all. And as we go down, less abuse potential, less dependency.
I wrote it as like worst, 1 being the worst, 5 being like the best, not the best, but like the best.
Less abuse.
Yeah.
Okay.
That's how I remember it.
When you're doing a med reconciliation with the patient and you're asking them what meds are they taking, what else is just as important? Yeah, supplements. What else are you taking? Oh, that's the only meds I'm taking. Are you taking any supplements, any vitamins? Oh, yeah. And all of a sudden, you know, there's the ginkgo bilobas, there's St. John's wort, there's massive vitamin. So when you're doing a med reconciliation, or you're just asking a patient what medicines are you on, asking about any alternative, any supplements, very important. As well as asking allergies. What do you think?
Over the counter too.
What's that?
Over the counter too.
Over the
Like-
counter. I take Motrin every day, yep. What patients are gonna have an alteration in drug metabolism? Beautiful, cause it's metabolized in the,
Liver.
excreted in the
Kidneys.
Beautiful. So yeah, anybody with liver disease, it may not say liver disease, it may say your patient, has chronic alcoholism. You need to be able to put together that chronic alcoholism is going to lead to liver damage. Okay? If a patient is getting a dose of medication parenterally, do you think it'll be the same dose when they get discharged and it'll be PO? Why? First pass effect has a lot to do with it, right? So 25 milligrams of compazine is not 25 milligrams of PO compazine. What happens with first pass, since you brought it up? What happens with first pass effect?
It's the amount of time it takes to get to your like tissues.
Most of the drug is destroyed before it reaches the tissue.
Yeah, on first pass, the drugs get absorbed in the small intestines directly, but by the time it gets there, that first pass effect makes it so only about half the amount of drug gets to where it needs to be. If you're giving 8 o'clock Medpass and you gotta give 5 medications, what should you do first?
I'm so sorry to interrupt. Do you have any idea where the fan went from yesterday? I'm not sure why it's still 100 degrees in there, but it is.
Do you know what? Go into the lab and turn the temperature down in the lab.
Well, where's the fan I have?
I have no idea, but try that and see if it works.
Okay.
We're gonna test in the basement. Alright, so the patient's gonna get 5 minutes. What's a priority action a nurse needs to do first? Say it again? Assess what?
Your vital signs, like if it's your blood pressure, your blood pressure, heart rate.
You're not wrong.
You wanna assess the patient identification?
Yes, but that's still coming afterwards. When you have to give 5 medications. Just think about it. Here you are, you gotta give 5 meds. You've done a med pass, right? With me. You gotta give 5 different meds. Before you even hit the patient, what should you be doing?
The interactions with each other.
Bingo, interactions. Because if you find there's an interaction, you're not even gonna make it to the patient. So, thank you. Somebody put it away, huh?
Yeah, probably Kramer.
So, checking for interactions, you can possibly say checking for allergies too. Because you can see, even before you hit the patient's bedside, there's an allergy and you notice they're allergic to salt that the doctor just ordered sulfonamide for a urinary tract infection. Before you even get to the bedside, you gotta figure out this. Interactions, figure it out. How would you figure it out?
Looking
Their
at,
history, their chart.
Okay, for allergies.
maybe looking at a drug book,
Looking in a drug book for interactions, calling
the pharmacist.
the pharmacist. They're usually pretty good at picking them up. All right. A patient's gonna be getting a new medication. What would improve adherence to a new medication? So think about, what do you do when a patient has a new medication prescribed?
Education.
Okay, you're educating. What are you educating on?
The benefits.
Therapeutic effect.
The therapeutic effects. Okay, so you're gonna get this medication, this albuterol inhaler, to help with your bronchoconstriction. It's gonna open up your airways. Okay? What else do you have? What else are you going to teach? How to use it effectively, right? Can't get the dose in properly, it's not gonna be helpful. What else?
Like adverse effects,
Bingo, adverse effects, why?
so they know what to like look for or what's common and what like needs like urgent.
Yeah, what are normal side effects? What can you almost anticipate? Oh, that bronchodilator. The normal side effect is, it's a sympathomimetic, so it's going to increase the sympathetic nervous system, and part of that is increased heart rate. Increased heart rate, sympathetic response. So when they take that inhaler, they might feel their heart rate going. This is a common side effect. A patient might think I'm having a heart attack, I better stop this. Something's wrong. But if you explain to them adverse effects, for example, my mom, antibiotic queen, right? She would get a lot of GI upset with antibiotics. Now, knowing what you know about antibiotics, what would you say to her? It's normal, suck it up, buttercup. No, you wouldn't say that, right? You might. Take it with meals, right? If you can go over the adverse effects, the side effects and the adverse, you'll have better drug adherence. Patients don't wanna take meds if they think they're having a reaction to it. They think it's a reaction. Ooh, you know, I get a lot of gas and diarrhea and cramping with antibiotics. Yeah, so does everybody else. Morphine makes me a little itchy. I'm probably having an anaphylactic reaction to morphine. No, you're not. You know, this is common. If you guys understand common side effects and adverse, you will promote better drug adherence. And just like with tuberculosis meds. What's the big thing with tuberculosis meds?
No one wants to do it for that long.
They don't wanna take it for that long. And so when they take it and their cough goes away,
They're
they
making-
stop. And then what happens?
It makes it worse,
Why does it make it worse?
because they didn't take the medication as prescribed.
Why does it make, you gotta go a little deeper than that, girl. Why? Tuberculosis meds have to be taken for 6, 9, 12 months.
The infection will become
Worsen?
resistant to the
Resistant,
antibiotic.
bingo, resistant. Multi-drug resistant organisms. You understand what that means? Okay. Speaking about drugs, if a patient is taking an antibiotic for a urinary tract infection and then develops a yeast infection, what is that known as?
Super infection.
What?
Super infection?
How would you explain it? Would you say to your patient you have a super infection? What is a super infection?
You got rid of like your normal flora to the bad stuff.
Okay. So it got rid of it wiped out the bad stuff, but in wiping out the bad stuff, it got rid of a lot of the normal flora. Okay, that's a super infection. Aside from a yeast infection, in women who take, that's usually, an example I use.
C. diff?
Beautiful, C. diff is another super infection. How do patients get that, generally speaking? Overuse of antibiotics. And not in a bad way, they could be using the antibiotics very responsibly, and they could be good stewards, you know, but it just wiped out all the good flora.
And then isn't it contagious?
C. diff is
Yeah.
very contagious. Yep.
Is that airborne or, I know.
Want a funny story?
Ooh.
Me and Pat Donovan, we were going for our CCRN exam. And, no, this was my CAPA exam. And we both traveled together, we were gonna stay in the same hotel because we had to take the exam in the morning. She wasn't feeling well, but once you pay, and these exams cost $300-400, you know, we're going. She didn't feel good, she wasn't eating, she told me bowels weren't right. In the middle of the night, I had to wake up, or maybe it was early morning, it was dark in the room. And I looked on the floor and I thought I saw something.
God.
So I think I had my phone with me and I looked, and there's shit on the floor.
Aw.
So I'm like, I go in the bathroom, I turn the light on in the bathroom, and I'm like, she wakes up and she's like, what are you doing? I said, Pat, there's poop on the floor. Oh my God, she said, I got up about an hour ago and I couldn't hold, I don't know what's going on with me. And there was there was a trail. So she got up, we cleaned up the mess. It got worse. It got really bad. Come to find out she had C. diff.
Did you get it?
I did not get it. I did not get it. Let's face it, I mean, I really washed my hands well, but there was a rabbit turd all the way in the trail to the bathroom. So that's my C. diff story. Pat does. Okay, but we both passed the exam, so it's all good. All right, number, what are we asking here? The risk of sedation, in an older person, what would be a nursing diagnosis?
Impaired airway.
Well, sedation, not opiates. If it was opiates, I could go with you with potentially impaired airway. But whenever we give a benzodiazepine, it causes sedation.
Which increases the risk for injury.
Yes, beautiful, risk of injury, beautiful. Explain to me the difference between medicating an adult versus a child. Yeah, weight is important for the child. Now, you've heard me say the very young and the very old, and there's reasons for that. Why? Why the very young and the very old?
They're more prone for the adverse effects.
Why?
Their, immune system is lowered.
Okay, their immune system of who? Children? Older adults or both? Both. What about their body surface area?
Children may have not developed all of their,
Organs?
yeah, and
Like their livers, their kidneys may not be fully developed, good thought,
or the immune system.
like she said. And then the adults, now, theirs is a little bit of a, yeah, they're on the
Withering
They're
away.
on the
downhill,
downhill.
right?
But
They're developed, but what's happening now?
They're falling asleep.
It's
They'll build up
withering away,
toxicity?
growing old.
Yeah.
Say it?
I said they'll probably build up toxicity because they're
The
so
toxicity,
slow
but again,
metabolizing.
why? So their liver and kidneys, like you said, they're decreasing their function. Now, what do we know about the glomerular filtration rate? Now, that relates to the
Nephron.
nephrons of the
The kidney.
kidneys, glomerular filtration rate. What do we know to be true? Especially with older adults. There's a decrease in the glomerular filtration rate. Right now, we're all sitting maybe at 100, 125. For every 10 years, we lose 10%. It's pretty substantial. So when you're hitting 70 and 80, you're probably already halfway, maybe your GFR is 60%. They do say that a GFR less than 65 is indicative of kidney disease. So again, the very young and the very old. For kids, it's mostly weight-based, those are the issues. For older adults, it's the effects of aging. Still not working well, but due to different reasons. Children are just underdeveloped, overdeveloped and aging, okay? They are also, older adults, they lose a lot of their muscle mass. A lot of their muscle mass gets replaced with, say it, that adipose tissue.
Older people?
Older people, they lose their muscle mass. We go from, sort of being buff to being a little flabby, do we not? Right? So when we go from muscle to adipose tissue, call it fat, certain drugs, the metabolism and the absorption are changed because of that. You have to know your conversions. So how many kilograms to pounds, how many milliliters to cups, how many tablespoons to teaspoons, how many grams to milligrams, how many milliliters in a tablespoon. These are all the things, metric system, that you have to know. So if somebody is hypovolemic from vomiting and diarrhea, what's going on at the cellular level?
They're dehydrated, so the cells lost their volume.
And what do they look like? Little raisins. Little raisins. Everybody gets that, right? Okay. Dehydration on a cellular level will take those cells and shrink them up like little raisins. What type of fluid would you give to somebody for dehydration? Isotonic. And what are the two generally given? Normal saline, lactated ringers. Beautiful, good girl. What do you know about the sodium potassium pump?
It's an active transport.
Mm-hmm. What's it involved in?
ATP.
ATP or? Energy.
Energy.
Beautiful. What are the goals of anti-infectives?
They interfere with the normal function of the invading organism to prevent it from reproducing and cause cell death.
I couldn't say it any better. Perfect. If a medication is given for a bacterial infection, tell me the difference between broad spectrum antibiotics and narrow spectrum. Narrow is specific to what?
When you culture, it's only targeting the bad.
Okay, so it's gotta be based on a culture, so that's a great test question right there. Your doctor prescribes an antibiotic. What's the first thing you do? Cause this is what's gonna happen. In an EMR, the doctor's just typing in orders. He suspects little Grammy Jane here of having a UTI. So he puts in there, antibiotic, urine for culture and sensitivity, temperatures, Q2 hours, you know, whatever, all the orders he puts in. Well, when you see it, you just see a whole bunch of orders. He doesn't put in, get an antibiotic, get a culture first, right? It doesn't say that. And they don't show first, second, and third, it's just all these orders show up. You have to know that before you start an antibiotic, you must do a
Get a
culture first. Narrow spectrum, if they wanted to wait, the reason I say here, let's just say it's Friday and little Grammy Smith is in a skilled nursing facility. She has recurrent UTIs, she's got another one, and you know this because her level of consciousness has changed. That is something that's very common in the elderly. Level of consciousness is very common. And so you notice it, doctor says, yeah, well, Grammy Jane probably has a UTI, I'm gonna order an antibiotic. Get a culture first, but start the antibiotic right away before she gets septic. What type of antibiotic would that be? Huh?
Broad first. Yes.
Broad. Because you don't really know, you don't have the results of the culture back, so it's a broad spectrum antibiotic. Do you understand that? Now, if it was you, if you had the UTI, we might wanna wait. you're gonna do better than Grammy Jane. Okay, you're not gonna go septic and die over the weekend. So we get a urine culture on you, we find out that it is sensitive to ampicillin. So we're gonna start you on ampicillin. That is narrow spectrum. Why is it better?
It's targeted to the specific
Yeah,
pathogen is gonna work.
it is targeted to whatever's causing the infection, whatever pathogen is causing the infection. Now, you could give broad, but what's broad gonna do? It's gonna everything. It's a big gun. It's gonna wipe out everything. And again, using and abusing antibiotics, this is where it occurs. So it's best to get culture, know what you're fighting. But somebody like Grammy Jane, you do understand why we would give her a broad spectrum, especially if it was over the weekend. Antibiotics interfere with other medications, but specifically what? Beautiful. So birth control. What teaching do you need to do?
Educate to use a barrier contraceptive.
Beautiful. Use another form of contraceptives. Beautiful. Good girl. A patient's on a big gun antibiotic, aminoglycosides. What should you be checking?
check the urine and creatinine levels.
Yeah, exactly. Now, it's just as important to check liver functions because drugs are metabolized in the liver, excreted. But we know that aminoglycosides can be very nephrotoxic. You know the term nephrotoxic, right? Why are viruses more difficult to treat than bacteria?
They're not living.
There's like a new strand of them. Like COVID, there's like always another strand.
Yeah.
And then they're changing, yeah, they're always changing, so.
Cause they're in the,
Like the embryo patterns.
What did you guys write down for that? Because that was a question I asked.
Cause serious toxic effects.
They constantly mutate.
Antibiotics and stuff don't work on it.
I didn't get there, I don't know.
Antibiotics don't work on viruses. Viruses are inside human cells. While they're in the body, they're living on that host. Researchers have difficulty developing effective drugs that destroy the virus without destroying us, the host. That's the problem. Fungal infections. Talk to me about fungal infections. Patient has athlete's foot, has been prescribed an antibiotic.
We need antifungal medication.
Okay, right, you need antifungal, not an antibiotic. Funguses are hard to cure. Know anybody who's had athlete's foot? It's very, very difficult. Fungus has a lot of different layers, which makes it very difficult. All right. Now, talk to me a little bit about a systemic antifungal drug. Systemic antifungal, what do you have on that? These are scary drugs.
Jaundice.
I knew I'd see a smile when you looked up at me. Come on. Systemic fungal drugs.
Anaphylaxis like angioedema.
They're high for, yeah, they can definitely cause anaphylaxis,
Photophobia.
okay? Like she said, hepatotoxicity. She said jaundice, she wasn't wrong. What causes the unusual bruising and bleeding? Relate that to something. Your patient is on aminoglycoside.
Bone marrow suppression.
Yeah,
Anemia.
you'd wanna go to bone marrow suppression, but it's not, it's actually related to what you said. No. You said jaundice. Tie in for me. If this drug is liver toxic, hepatotoxicity, tie in the symptom of bruising and bleeding. What does your liver do?
Metabolizes.
I like that. Something else though. Come on, people think. Do we not know our liver well?
It filters blood.
Say?
Is it clogged, like the?
Probably you're getting bad blood because it's not filtering the blood, or
What else does your liver do?
Something with red blood cells.
Clotting. Clotting. I want you to go back today, look up your liver, figure out what is it that my liver does. Yes, it metabolizes, that's true. But if you have a patient who's on an aminoglycoside and the drug is hepatotoxic, the liver is not gonna work well. Yeah, it won't metabolize well, you'll have issues with jaundice, but also the liver produces clotting. So I want you to understand that concept a little bit more. So look up the liver and what it does. Because if you don't have a healthy liver, you don't have the clotting factors. Clotting factors are produced in the liver. Therefore, patients are at risk for bleeding. And if they're at risk for bleeding, and you have a patient in front of you who has multiple areas of bruising, you need to be thinking that this could be a serious side effect of an aminoglycoside. Okay, I want you to look that one up, do a little more research on that one. What's the most common parasite, intestinal parasite in the United States? Yep. Giardiasis, and what is it? Intestinal parasite. What are the signs and symptoms?
Weight loss.
A lot of weight loss. Where do we get it? How do we get it?
contaminated water and food,
Water and food.
person to
Yep.
person.
Beautiful.
You use Flagyl.
Use Flagyl.
What is it called?
What type of drug is Flagyl?
It is azole, which is an
A
anti
fungal, right?
fungal.
Mhm.
Here, I don't know how to say it.
Okay. If you have a patient who is of childbearing age, have to worry about contraception, but just make sure when you read a question and it says childbearing age, right away you're thinking it's gotta do something with contraception. If you have a young mother who has a young infant, what do you have to be concerned about? Breastfeeding. So you need to ask these patients, if a scenario gives you, it's a young mother, she has a young child. Your next question is, are they breastfeeding? Because if they're breastfeeding, what happens to drugs?
It could be passed through the breast.
They go into tissues and fluids.
Yeah, the drug can get to the baby just from the breast milk. Very, very important. A patient who is getting anti-neoplastics, What are anti-neoplastics?
Or, cancer.
For cancer, right? So if you're giving anti-neoplastics for cancer, what type of patient teaching related to the drug do you have to do?
Your immune system
What about it?
is compromised. If you
Okay.
have white blood cells,
So,
so take precautions with your family friends going out.
because I feel like I'm pulling teeth, right?
Because you'll get super sick.
You'll get super sick, right? So immunity down, infection up.
Beautiful.
Can we take a break? I need a break.
Okay, so infection's a big thing. What else? So anti-neoplastic, chemotherapy, cancer meds. Patients are at risk for infection because it really knocks the immune system. What else does it target?
All the cells in the body. All your cells.
Cells. Where?
All over.
All over. Where are your cells produced?
Bone marrow.
Bone marrow, so bone
gonna-
marrow
Suppression.
suppression. And so now what do we look at? When we have bone marrow suppression, all cells, you guys know your cells. So somebody who is getting cancer medication, they're at risk for bone marrow suppression. Tell me, red blood cells, what am I gonna look for?
Yeah.
Anemia,
Chills.
white blood cell. Be specific with cells. Red blood cells, anemia. White blood cells,
Infection.
infection. Platelets,
Clotting.
clotting and bleeding. Okay, you have to know your cells and what they do. So white cells, red cells, and platelets. I don't even know what the question asked. Let me go back to it.
Anti-neoplastics for cancer.
Sorry guys, let me see where I left off here. Oh, I missed one. You took notes on albendazole.
Mm-hmm.
Talk to me about albendazole.
It's a anti-helminthin.
Okay,
Thick.
what's a helminth?
Helminth, a worm.
Yeah. What does it do? Gets rid of the worms. What else do you know about the drug?
You can have temporary hearing loss.
Okay, you could have temporary hearing loss. What else about the drug?
You have to monitor their liver and kidney function.
What more?
Liver,
Choose kidney.
kidney.
Yeah,
Choose
yeah.
kidney. Oh.
Kidney function needs to be monitored. You can have some serious drug effects from albendazole. All right, back to the cancer patient now. What is some patient teaching? Knowing what you just told me about the cells being affected. What are some teaching points? patients getting chemotherapy.
Hair
You-
loss,
What's that?
hair loss,
Okay, that's a big one. What's the name of it?
alopecia,
Okay. What else?
weight loss,
Weight loss,
nausea, vomiting,
nausea, vomiting,
risk of infection,
risk of infection. Looking for one more.
And bone marrow suppression.
Okay,
Well, it's infection.
elaborate. You know, it's never good enough, right?
Bone pain.
No, not bone pain.
is it like
Think of all your cells again.
Anemia,
Bleeding, bleeding, bleeding.
risk of bleeding,
the
Yeah.
platelets.
Guys,
Okay.
risk,
gotta know those cells, platelets. Chemotherapy is gonna wipe out all the cells. So you, again, you know your red cells, you know your white cells. Let's not forget about platelets.
so that's like, that would be a nursing priority for teaching,
Yeah, and what would you teach?
safety, so.
Safety, because God forbid you fall, you're gonna have a bad bleed. What else? What do men do?
Shaving,
Shaving,
Use electric razor,
use electric razor,
soft brush,
a soft toothbrush.
bristle. Yeah.
From a nursing perspective, we wouldn't give, any suppositories rectally. We wouldn't, check a temperature rectally because of bleeding. All right, start bleeding, feel like you're weak there. Lots of stars, right? Non-steroidals, what are they doing?
Decrease inflammation.
Decreasing inflammation. What interaction do they have with with antihypertensives? Guys, look at your notes, right? Did you do the notes?
I'm not completely finished, I'm gonna be honest.
Okay, I like honesty.
yeah.
I'm still working on it.
So it increases your. You take
But what meds? Specifically, non-steroidal anti-inflammatories react with the antihypertensives. Which antihypertensives? Yeah, beautiful, beautiful. Know what medications you would give to a child who's having a fever? Safe, right? What meds do we usually give? Acetaminophen. Sometimes we also mix that with a little, ibuprofen. And they, you know, they'll give it both at this, like, alternate it. Now you realize, what's the difference between acetaminophen and ibuprofen? Do both lower a temperature?
Yes.
Yes. Do both treat inflammation?
No.
No. Which one treats inflammation?
Ibuprofen.
Okay, beautiful. Leukemia and an immune modulator. What do you need to teach? Leukemia and an immune modulator. Have anything written down?
I wrote down leukemia with childbearing age.
Yeah, very good, very good.
So you want to use barrier contraceptives and no
Mhm.
breastfeeding.
Excellent, that was good. Tell me about active immunity, passive immunity.
Active is like built immunity, or
Say
like
it again?
it's like a built immunity,
Okay,
like vaccines or like just getting sick and getting better.
okay,
Passive immunity are antibodies from other people. For example, you got the baby and the mom. The baby has passive immunity because the mom has the antibodies.
okay, beautiful, good. What's serum sickness?
I didn't write that.
Anybody write down serum sickness?
Sounds
Serum
horrible.
sickness is a massive immune reaction against injected antibodies that occurs with passive immunity. That's what serum sickness is. What are some normal reactions to immunizations? What happens when you get an immunization?
You're gonna have soreness.
Mhm.
You're gonna probably have a fever,
Maybe.
some pain,
Pain, redness at the site.
swelling.
And a
Every-
little sick.
Yeah, because what's happening?
You're being introduced to antibodies.
Your body is sort of mounting an immune response to that vaccination. Are you actually getting the disease? No. Depolarization. When depolarization occurs, tell me something about that. Sodium does what?
Rushes into the cells.
Yep, sodium goes into the cell. Depolarization causes contraction or an action potential. That causes a contraction. PO meds work how quickly?
30 minutes.
Okay, about 30 minutes. What does tapered mean? The word tapered.
Slowly decrease your dose.
Right, don't abruptly discontinue a medication, taper it. What drug comes to mind? There are a lot of drugs, but what drug comes to mind?
Narcotics,
Okay, narcotics.
ADHD medication,
A lot of meds, really.
Elliptic.
steroids.
Beautiful, I was thinking that, corticosteroids, usually on a tapering dose. Now, they all are tapering for different reasons. A drug like a corticosteroid is affecting the adrenals. So you could put somebody into an adrenal issue if you just abruptly stopped, okay? Depression, all those neurotransmitters, can you name them for me?
Norepinephrine.
Yep.
Dopamine, serotonin.
Beautiful. What is a priority assessment when somebody has been started on an SSRI? First of all, what is an SSRI?
The serotonin.
Antidepressant.
SSRI, reuptake inhibitor. What's it used for? Depression. And what do we have to monitor for? What is a severe,
Suicide.
yeah, more than severe, I guess, right? Fatal suicide. Especially in what clients?
Children.
Children, pediatrics. Talk to me about lithium salts. Hydrate, 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 right? What are we taking lithium for? Bipolar disorder, bipolar disorder. And hydration is huge. And think about it, lithium salts. What will salts do to your body? Okay? If somebody is on lithium and they're dehydrated, what happens to the lithium? Toxicity, lithium toxicity, very good. Reoccurrent seizures, what's the name? You got it. Status epilepticus, right? What drug can you, anticipate if you're in the ER giving a patient who's having a recurrent seizure? Phenobarbital. Tell me something you know about phenobarbital. It's used for seizures. What else?
Emergency seizures.
Emergencies.
And it's older.
I didn't say, is it a good drug? It's got a lot of side effects. It's really got a lot of side effects, so tried and true. We use it when it doesn't respond, you know, somebody doesn't respond to other medications that have less side effects. But it is still alive and well in the ERs. What do you know about Parkinson's disease?
No dopamine.
Hmm?
No dopamine.
Yep, levels of dopamine are lower. What else?
Progressive.
They have dystonia.
Extrapyramidal symptoms. Tell me about extrapyramidal.
Drooling.
Shuffling gait, mask, dystonia, mask-like expression,
Unnatural movements.
unnatural. Can you control them?
No.
Okay, beautiful. That you need to know, okay? When it's extrapyramidal, they're out of our control. What electrolyte is responsible for that contraction and relaxation within muscles?
Calcium.
Calcium, okay. What about potassium? What does that have to do with? Your heart, okay. What about sodium? Noel, you said it before.
Yeah, for contraction.
Sodium though, what does that regulate? And I'm only saying it to you because you talked about dehydration with lithium salts. So sodium, water balance. Okay, sodium's responsible for water balance. Look up phosphorus.
For muscle contractions.
Phosphorus,
Okay.
phosphorus never gets enough airtime. So do me a favor, look up phosphorus right now.
Stability, energy, metabolism, kidney function,
Nutrition,
nutrition.
beautiful, okay. We don't talk about phosphorus that much, and it really is important as well. Even when we look at labs and we're looking at electrolytes, phosphorus is like at the bottom, but it has a lot to do with nutrition, metabolism and such, okay? Gotta give it a little bit of credit and airtime. All right, baclofen, what do you know about baclofen?
It treats muscle spasms.
Okay, and what disease process? Be a lot, but which one comes to mind? Muscle spasticity. MS, multiple sclerosis, good. Central nervous system effects, especially with narcotics. Who is most at risk? Yeah, the elderly, they are definitely more at risk. So if they're more at risk, what are some of the nursing interventions we do?
Safety.
Such as,
For falls,
get the rails up on the bed, bed alarm, call bell and reach, bed at the lowest level. Think about interactions as well. So you don't really wanna give an opiate with another CNS depressant such as,
Alcohol.
oh, alcohol. Don't give your patient any drinks in the hospital, right? You laugh, but there used to be a standing order for 6 ounces of sherry before bedtime.
Really?
Uh-huh.
That sounds so cool.
Sherry.
I wish I was a nurse back
Not in
then.
the hospital, but like in a skilled nursing facility, when I came across it, I was like, is this okay? Is this allowed? Yeah, it is.
so like barbiturates.
Or benzodiazepines, yep. You don't wanna give them together. What do you have to do before giving an opiate? What type of an assessment specific to opiates do you do?
Level of consciousness.
Level of consciousness? What else?
Bowel assessment.
Huh?
Bowel sounds.
Yeah, but not a priority.
Respiratory.
Respiratory. Narcotics, opiates cause respiratory depression. If I had to choose between respiratory and level of consciousness, it would be respiratory. Okay? When giving a medication, such as morphine, it's an opiate, what action should the nurse perform? So, talk to me about morphine. How do you give it safely?
Probably one of the antidote.
Say it again,
The antidote.
which is naloxone. I know you wanna say Narcan, but you're not gonna see Narcan. You're gonna see naloxone. So you wanna make sure naloxone is there. You wanna make sure your antidotes are there. Did you guys study all your antidotes? Important. If a medication error has been made, let's talk about a scenario. Say you have a patient who's in the ER. They had, I don't know, got morphine for pain. They come to your unit. They're still having pain. You medicate them. Only to find out that the nurse in the ER gave 4 milligrams of morphine just an hour ago, but she didn't document it. Let's walk through this scenario with you. What would you do?
Assess patient, call
First-
provider.
I love it. First and foremost, always assess patient. If you don't know the right answer, just choose assess patient, because you can't go wrong with that. Assess the patient. What are you going to assess them for?
Respiratory.
Respiratory first, definitely. Are they breathing?
Heart rate.
Level of conscious next. And you'll probably know it. You'll walk into the room, hi Mrs. Smith, how you doing? Right away you're gonna know what her level of consciousness is, and then you're gonna look at her respiratory rate. See how she's breathing. All this can be done like really from the doorway, looking at respirations. You realize you've given a double dose, but is it your fault? No, it really isn't your fault. She didn't document, so somebody made a mistake. So when a mistake happens, what do?
Make a report.
You gotta make a report.
Call
I'm
the
not gonna,
doctor.
say it again?
Call the doctor.
Well, personally, I wouldn't call the provider right away. I mean, I'd assess the patient first. But if the patient was symptomatic, meaning
Antidote?
I'd have to get it in order. Even
Oh.
though I say have an antidote ready, you still need an order for an antidote, right? Okay, unless there's a standing order. So if the patient's symptomatic, you would call the provider. And I'd probably call them anyways, just to CYA. Okay? A patient, especially an elderly patient, can look good until they don't look good. You give them 4 milligrams, the ER gave them 4, that's 8 milligrams. Somebody who's opiate naive, you guys know the term opiate naive? Somebody who doesn't generally take opiates on a regular basis, so I guess that maybe I'd be a little opiate naive, okay? 8 milligrams within an hour, probably gonna cause some problems with me. So calling the doctor, the reason I say call the doctor, and I'm not big for calling the doctor right away, but I know I'm gonna need Narcan. Like, I might need it. I would rather have it available so that I can give it if this person, if their respiratory rate goes below, what number?
12.
Yeah, I say 10, but people might say 12. When they start going below 10, I gotta start thinking about giving Narcan. And if you've been in the hospital, how long does it take to reach a doctor? Sometimes it can take a while. This you can't wait on. Like, somebody has to get Narcan. That's the only reversal agent for morphine. You're gonna make sure you're documenting the event. I would probably call the supervisor, make her aware of the situation. Yes, you'll be filing a report, but not the first thing you're gonna do. I'd put them on a monitor. I'd get them closer to the desk. I mean, I'd wanna make sure that they're properly being monitored, and you gotta know what that means. So placing on a cardiac monitor, eyes in the room, move them closer to the desk, make sure the provider has given an order for Narcan. Whether you use it or not, it depends.
So if you see the patient is on morphine, you can, if you don't have maximum and there's an order, you can say, hey, can we get an order just for that?
A lot of times when the doctor orders it, they will write an order for Narcan, and they'll put on there, if respiratory rate decreases below 10, here's your order. But you still should be thinking about it in case they're not. What type of medication decreases the client's sympathetic stimulation and ensures that the client doesn't remember the procedure? What type of medicine?
Midazolam.
Midazolam. Very good.
Midazolam.
Midazolam, what type of category of drug is it? No, you said that the last time. See, perfect example, and I remember, I can't remember what I did 5 minutes ago, but
I got it wrong.
yeah. When we get something wrong, right away you went to it, right away I remembered you saying that. You have to make a very conscious effort to change the wrong answer and make it right in your head. Because you will always go back to it if you don't, just like you just did now. So you have to do something. It's not enough just to say, oh, okay, yeah, that's it. Write it down if you have to. And put verse said, midazolam, hypnotic, amnesia. You've got to do something. So when you're doing prep use, or you're doing from here on out, because you guys got me again next semester, when we're doing prep use, when we're doing test questions, when you get something wrong, you have to look at that rationale and understand, why is this the right answer? Because if you don't, when you take a test, you will default right back to that wrong answer again. halfway done, guys.
Take a 5-minute.
Oh, yeah?
So we can use the restroom. I don't
Okay.
wanna miss anything.
Okay, yeah, take 10 minutes, okay? I forget, people, I just can keep going and go like the Energizer